go?
Yeah.
Good evening, everyone. I'd like to introduce QueryMinds, where we help healthcare staff find vital information without the endless searching. Now, I'd like to picture this. You have a medical doctor, a room full of waiting patients, and 3 hours every single day spent searching for vital information. It's not just frustrating, it's costing our NHS £13 billion every single year. And that's why we created QueryMinds. Healthcare professionals cannot quickly access the information they need to do their jobs effectively. 30% of all staff time is consumed just by searching for information. 9 out of 10 healthcare staff struggle to find the right information when they need it.
The only solution to this is QueryMinds, a data analysis and retrieval system. We utilize the organization's operational documents and clinical documents, providing instant cited answers to our users. Not only this, but we're fully compliant with both GDPR and NHS data and compliance. The initial market we're addressing is the UK market at £4.8 billion. Our 3-year plan is to target 1% of this, which is £28.8 million in annual recurring revenue and 25 NHS trusts.
In fact, we're already in discussions with 3 of these NHS trusts and anticipate to roll out our prototype in the upcoming years. We have validated our product with over 50 healthcare professionals, 92% of which have resonated with these critical pain points in inefficient information retrieval. And I've said that QueryMinds is poised to tackle this problem head on. Let's see how QueryMinds works. A healthcare professional puts in a query into our system, and our system provides a referenced, instant, context-aware answer. The cool thing about QueryMinds is we have an analytics and feedback platform that users can give feedback to the query response that they receive for industries to feedback on their documentation. And for any unanswered queries, we have a human-in-the-loop system for live agent support.
Compared to our competitors, QueryMinds is the only healthcare AI doing what we do. Not only this, but we're fully integrated with clinical workflows, medical terminology, and as mentioned, we're fully compliant with the regulatory bodies. We follow our business-to-business SaaS model with 2 subscriptions, the most popular being the enterprise model. This is because we provide ongoing consistent support, full functionality of the AI, and finally, unlimited data uploading.
So our team is comprised of a medical doctor, a software engineer, and an electronic health record specialist. Combined, we have over 20 plus years in the front line of healthcare, and we're equipped to tackle this problem head on.
So our big ask is actually 3 things. The first is £8,000 for full deployment, refining and training our AI, and finally running more pilots. The second ask is specifically to you judges. We appreciate that you've developed a network of investors and partners. We'd love to discuss our business further and gain your support in warm introductions. And finally, to the audience itself, we've recently created a LinkedIn business page. We'd love for you guys to follow our journey, so please follow our page on LinkedIn, QueryMinds.
And join us in transforming healthcare. Help us empower healthcare professionals to spend less time doing paperwork and more time with their patients. Thank you.
Kim, I am very well versed in this. I actually have a healthcare background, so I appreciate this. Now, talk me through adaptability. How are people going to be using this product in terms of like real-time data retrieval? Is this something on a computer, a phone? And also, when you say that you've gotten feedback from like 50 different people, talk me through that as well.
Yeah,
What does that look like?
Absolutely, we really appreciate your feedback and your kind question. And I can give you an example of me working last week, where I had a patient in the ED that comes with a very complex cancer background, and I needed to prescribe the correct antibiotics for him. A simple Google search on our documentation doesn't cut it. I'm left with about 15 results, and especially in the context of healthcare, we need to be precise, accurate, and reliable. Likewise, that information that I need for that antibiotic, for that specific cancer patient, is stored away in these silos of documentation. So having an app like QueryMinds, where I can instantly find that answer, is exactly what we're aiming for.
To answer your second question about how we obtain this data, since summer, June, July, we've essentially started to run forum groups and focus groups with clinicians, operational support staff as well, such as program managers with NHS and project managers as well. Myself, I'm actually a project manager with the NHS, specifically focused on electronic health records. And what we've done is identified what they do on a day-to-day basis. So only at the end of January, we ran with 8 GPs what they would do and how they would obtain the information relevant to their patient. And we found that it takes between 3 to 15 minutes to find the key information to make them take an action.
Great answers. I have a follow-up. Is that okay with you guys? How are they giving you feedback, right? Is that something that they press a button, like this was correct, this was wrong? How are you guys getting the feedback loop?
So in relation to the AI that we're developing, how we get feedback is literally exactly what you said. So as mentioned in how it functions, you would ask